Well, we have this annual ethics conference here at the Montreal Children's Hospital, and we pick a particular focus each year. And when it's been at least 2 or 3 years now, we've been thinking we need to make childhood disability, ethical concerns relating to childhood disability, the focus. A lot of the case consultations we work with, a lot of the teaching that we do, at the very least indirectly, but many times directly, really relates to people's beliefs and values relating to different forms of disability and how it matters and the amount of priority we ought to accord to sustaining certain types of lives where there seems to be a real diversity of opinions on whether these are lives that are worthwhile to support or not. This is such a recurring issue that, and in following it very closely as a pediatric ethicist, it's very clear that there is no real developed literature, there's no real sense of framework on how to talk about ethical concerns with disabled children. And what's particularly striking is that it pushes us to move into a whole new realm of thinking about ethics in children and building on the very strong terrain where we talk about things like consent, we talk about respect for the dignity of the child, having good end-of-life care, preserving confidentiality as we should, and this concept of the child's best interest, which is so sacred and so precious and so valuable, and yet so problematic and hard to apply that we keep scratching our heads to sort of find out how to do it right and well. But when we're talking about childhood disability, there's this whole other dimension that never is addressed explicitly, and that has to do with fairness, unfairness, equity, inequity, social justice. There seems to be many times an implicit understanding that these children don't count in the same way as other children. And maybe the best way I could demonstrate that is by telling a little bit about sort of my earliest significant transformative experience with childhood disability. When about 10 years ago we applied for a grant in order to study the experiences of families with children living at home with ventilators. At that time, I had been the head nurse of a pediatric ICU for coming close to 20 years at the time, and I am very ashamed to admit my driving, and it wasn't explicit for me at the time, my driving motivation and agenda for doing that research was to help explore what are we doing here. I remember when these children and families would be readmitted to the ICU, how stressed out they all looked. And we were all wondering ourselves, what have we done here? Why are we saving these really complicated lives, and for what? These families look like they're falling apart, the children look terrible. This whole thing it's just gone off track. What kind of ethical sense is driving all of this? And my goal in driving that study with the team that I was working with was to try to help us understand and help uncover the significant hardships, the difficulties, the stresses that these children and families were living on a day-to-day basis. That was a pretty serious prejudgment, more properly said, prejudice, that I brought to that study. In fact, as we had recruited family after family into the study, what was interesting was the way they kept trying to redirect us. They saw that we were out to document all of the stresses and all the hardships. But it took us a while to notice they were trying to tell us that that's not all that their life was. They tried to say, yes, life is hard, but there are a lot of good things too. It's also rewarding. It took us, and they really had to sometimes pretty much almost like take us by the horns to tell us, like, there's also something positive to this. We ended up entitling our most famous paper on this that was published in Pediatric. So we gave it the subtitle, Daily Living with Distress and Enrichment, the moral experience of families with children requiring home ventilation. Daily living with distress and enrichment. We came to the discovery that a lot of the most stressful moments in life are really intertwined with the things that matter the most, the things that are our most important strivings. And it's very problematic to just seek out to identify, document stresses, and then look to see how we can get rid of them. Because in cases like this, it means having these children no longer be. And the families very effectively and strongly pointed out that there is so much systematic prejudice towards their children, that their children are looked at as monsters when they're out in the community, is that they're at their best when they're at home, when they can create an environment where they aren't being judged. But once they go out and they can adapt to the medical care that's required, we all think, we're medicalizing these homes, we're turning these homes into ICUs, and this is horribly tragic. But in fact, these homes were adapted, where in fact the ventilator had a little cover on it, and the hospital bed had a big duvet, so that in fact the medicalization was really just absorbed into what looked like a regular home. What they pointed out was, in fact, the most significant problems for them were both physical and social barriers that they faced everywhere, including healthcare professionals, including when we return to the hospital because our child has pneumonia. Each time you ask us, do you want everything done? What are you telling us? Do you ask every child with asthma that shows up here, or with diabetes, do you want everything done? You are telling us your child's life is optional, and we're okay with ending it here if that's what you would like. The hurt and how offensive this is for so many families, for me, was a revelation, and for our team, was that we really had come to characterize these lives as wrongful, as just burdens. I mean, that's another term that's used a lot. Burden, family caregiving burden. This is all over the literature. It's just so focused on the negative and on the problems, not to be diminished, and not to be embellished. These are incredibly important. But there are pleasures, there are rewards, there are satisfactions. And what you come to discover as well, a lot of the stresses and the hardships are fairly easily reconciled problems. It really requires a modest investment because most of these families are really prepared to go very far towards doing as much as they can on their own. They just require a little bit of accommodation. Just throw us a bone. I mean, I think it's what a lot of families are saying, or at the very least, don't throw rocks at us. So that's how I personally got into this whole worry about the way in which we understand disabled children and the ethical considerations relating to their lives.